For years, public health guidelines have repeated a simple, urgent message. Simply sitting is actively destroying our health. That anxiety spawned a massive industry of standing desks and walking pads, all built around a desperate goal to slash the total number of hours we spend in a chair. But telling someone to sit less is an incredibly vague target. Does just subtracting 1 hour of sitting from your day actually do anything to improve short-term heart health? Broad negative goals usually fail in practice. When the instruction is simply to stop doing a behavior, it creates a vacuum, one that requires a highly specific, scientifically validated routine to fill. To find that routine, we have to look at a demographic facing an immediate biological deadline, the menopause transition. This is a period of sudden cardiovascular vulnerability that occurs entirely independent of age. Take a look at this graph. It maps cardiovascular risk factors over time. Right here, during the menopause transition, you see a sharp upward inflection. Women experience rapid spikes in blood pressure, insulin resistance, and unfavorable changes in cholesterol. For these women, establishing an effective behavioral intervention carries the weight of a clinical necessity. And if scientists can solve this high-stakes health crisis for such a vulnerable group, the resulting data could reveal a more effective cardiovascular strategy for everyone. To test this, researchers Dr. Cherie Hartman and Dr. Andrea Lacroix at UC San Diego launched the Rise for Health study. Backed by major funding from the National Institutes of Health, the team designed a rigorous 3-month randomized controlled trial. They recruited nearly 400 sedentary, postmenopausal women with overweight or obesity. Before the study, every participant spent 7 or more hours sitting down each day. Over the next 12 weeks, the researchers put competing behavioral interventions to a strict clinical test. They wanted to answer one central question. When you force different movement patterns into a sedentary lifestyle, which specific habit actually lowers blood pressure? This diagram outlines 3 groups. Group 1 received health tips. Group 2 reduced total sitting time. Group 3 focused on standing frequency. Group 2 cut sitting by roughly an hour. Paradoxically, despite this, they saw no significant improvement in blood pressure. Now look at Group 3. Over the entire 3 months, they did not meaningfully reduce their total sitting time compared to the control group. Instead, they focused entirely on repetition. The women in this group increased their sit-to-stand transitions by 25 to 26 times a day. This bar chart shows the final blood pressure readings. While the sit-less group saw 0 change, the sit-to-stand group experienced a measurable decrease of 2.24 millimeters of mercury in diastolic pressure and a drop of over 3 millimeters in systolic pressure. The data proves that how often you interrupt sitting creates a much stronger, more immediate cardiovascular response than how long you sit overall. The researchers derived a crucial insight from these numbers. Sitting duration and sitting interruption are entirely distinct behaviors. The physical act of transitioning your body weight from a chair to your feet forces your leg and core muscles to contract. That sudden mechanical demand triggers an immediate vascular response that you simply don't get by standing completely still at a desk. While shrinking your overall sitting time likely holds long-term metabolic benefits, frequent transitions provide an acute short-term stimulus that your heart and blood vessels respond to right now. Based on these findings, sitting acts as a physiological state that requires frequent physical interruption to maintain healthy circulation. A drop of 2.24 millimeters of mercury might sound small, but achieving this in a mere 12 weeks is a highly significant cardiovascular victory. The medical gold standard for a clinically meaningful drop is 3 to 5 millimeters. Maintaining this simple transition habit beyond the 3-month study window could easily bridge that gap and yield compounding benefits over time. It is worth noting that some bodily systems take longer to adapt. The researchers found no improvements in blood sugar or glucoregulatory biomarkers within this specific 3-month timeframe. This approach delivers an immediate cardiovascular response for a demographic facing heightened heart risks. So, how do you put this into practice? Hitting the clinical target of 25 to 26 daily transitions is highly realistic. If you are awake for a standard 12-hour day, you just need to stand up roughly twice an hour. There is no intense exercise required, no costly under-desk treadmills or drastic lifestyle overhauls. As the study authors point out, You can actively and effectively support a healthy blood pressure, even if you don't technically sit any less. You can let go of the negative burden of trying to endure fewer hours in a chair and focus entirely on the positive, self-directed goal of simply adding more standing breaks.